We are expecting over 1 million people to lose their Medicare coverage next year. 1 million. Many of the biggest insurance companies are canceling a huge amount of their plans, and they're stripping benefits out of even more of their plans. So if there ever was a time or a year for you to pay attention to what's happening and look at switching your plan, this is the year. Because if you lose your plan, you'll have to pay the 20% of all your medical bills because you'll be put back on original Medicare. But even if you aren't one of those people who loses a plan, you still should seriously consider which plans are available and should you switch your plan anyway, because Medicare is a lot like cell phone plans. Your mobile carrier is constantly coming up with new plans with different benefits. They don't automatically switch you over, even if it's better for you, right? How many times have you gone down to your cell phone carrier and been like, wait a minute, you've got a new plan? You never told me about that. What's worse is they sometimes silently remove benefits from your current plan, and a lot of Medicare plans are doing the same thing, and they increase the cost when there's something better for you. And when a new plan rolls out, no one tells you about it. Your insurance company may have a newer version of your plan, and you don't know it. So in this video, we're going to look at 3 situations when you should look for a better plan for your needs during annual enrollment period. The first situation is when your prescription drug coverage becomes too expensive. If you're not careful, your plan can make your drugs a lot more expensive next year. They do this by changing your medications, which formulary tier they're in. They do it sometimes by just removing medications. Sometimes they can stop covering your prescription drugs altogether without you realizing it. When this happens, you should seriously consider moving to a different plan. You will know this happens by reviewing your annual notice of change, and that will help you to know before it happens. But let me explain here that this is something that applies to both Medicare Advantage plans and standalone Part D prescription drug plans. So if you have a Medicare supplement and you have a prescription drug plan, this applies to you. If you have a Medicare Advantage plan, this applies to you as well. Every year, insurance companies update what is called their formulary. Basically, a formulary is the official list of medications and how much you will pay for each medication. But here's the tricky part. Your plan's formulary changes every single year. Now, I say that. Some years it doesn't change, but it can change every single year. Not only can the drugs be added or removed from the list, but your plan can also change how much you pay for your medications. And they do this not only in the plan section where they talk about the copays, but they also change it by changing the tier of your formulary. So let's say you're paying $15 a month for your medications now. Next year, the same drug could be bumped up to a higher tier. It could jump to the $95 a month tier. Or worse, it could be completely removed from the formulary and you would have to pay 100% out of pocket, or go to your doctor and find another medication that works for you. That's a big surprise that nobody wants, right? The good news is that you don't have to be caught off guard like this. Every year before September 30th, your insurance company should send you your annual notice of change document. It goes over all the upcoming plan changes. I've been talking about it in every single one of my videos because I want to make sure that you know that it's there. I promise I won't belabor the point, but the annual notice of change or ANOC letter, it comes in the mail, or if you receive your notices through email, then it comes through email. If you haven't received yours already, call your agent or your insurance company and make sure you get a copy because it's so important that you read yours. It's specific to you and your plan. Now, once you check and you see that your plan is changing and that your drugs are going to become a lot more expensive, this is a very good reason to switch plans during annual enrollment period. And so that's why it's my number 1. The annual enrollment period is upon us, but it only lasts until December 7th. I always recommend that you shop for Medicare plans to see if you can save money or find new benefits. And if you want help, you can call us at the number on your screen and we will show your options at no cost to you. Okay, now back to the video. Another reason to switch plans is when your plan, especially if it's your Medicare supplement plan, is becoming too expensive for your budget. You might like the coverage that you have in your plan, but it's costing you too much to have it, especially if you have to cut back in groceries or essential things. I mean, I've met people who were skipping their medications so that they could provide food for their pets. So if you're in that situation, it's time to look for something that will fit your life better and fit your budget better. And this can also happen to people on Medicare Advantage. Your $0 a month Medicare Advantage plan, it might have an increase. And if it goes up $15 a month, Well, that adds up. If it goes up $20 a month, that's another $240 a year. So keep an eye on your annual notice of change to see if there are changes. But what we see is this painful price increase is happening a lot more to people with Medicare supplement plans. And this is because most Medicare supplement plans increase their rates every year. They usually adjust them one time for inflation, and they often adjust them once for your age. And that depends on the state that you live in. But you're going to have an inflation increase, and usually you'll have an age increase. And with the rising cost of healthcare, some of these increases have been unbelievable. They have been extreme. Some reports show that the Plan G, the most popular Medicare supplement plan, is increasing as much as 10 to 15% a year across the board. And this has happened multiple years in a row now. So a plan that only cost you $150 a month when you first signed up can easily cost you $220 a month by the fifth year. And this doesn't even include your Medicare Part B premium as well as your Medicare Part D prescription drug plan premium. So remember, if you're starting to have a hard time paying for your Medicare supplement plan today, it's only going to get worse as the years go on. Now, you might say, okay, since my Medicare supplement plan is getting really expensive, I'll just switch to a cheaper Medicare supplement plan. But here's the tricky part. Switching from one Medicare supplement plan to another cheaper Medicare supplement plan may require you to answer medical questions. And if you've had health conditions, the plan may deny your application. Some states, though, they allow you to switch to another supplement plan without medical questions during or around your birthday. They call it the birthday rule. Many states now have that. But in many cases, you may not be able to switch. And so I've got this graph here. It shows so much of what you can do with Medicare supplement plans. I mean, it's a lot. There's a lot that you have to consider here. So if you look at this, we have the state, we have when you can make a change, what type of plan you can switch to. And you see all of these states have different rules. Many of them will only allow you to change to one carrier or maybe to just only the same plan or sometimes to another plan. I know this is a lot, so if you want to, you can pause the video and have a look at this right here. Go ahead. But these are the exceptions, not the rule. The good news is that if you have a Medicare Advantage plan or if you want to go to Medicare Advantage plan, you can always do that, even if your supplement plan is becoming too expensive, but you may or may not be able to move from one supplement plan to another. And don't listen to all those YouTubers out there who say Medicare Advantage is dangerous or is a scam. It's just not true. The truth is Medicare Advantage is pretty much the same as what your employer health coverage was when you were working. It's the type of insurance you had your entire lifetime, a PPO or an HMO from an insurance company that also has a network of doctors. Now, remember, you can't just switch to a Medicare Advantage plan anytime you want. You have to do it at the right time. So for most people, you can only join Medicare Advantage during the annual enrollment period, which runs from October 15th to December 7th every year. And always remember, the monthly cost of your plan will almost always go up over the years. So always calculate your finances. And if you see it becoming too much, consider switching to a lower cost plan during the annual enrollment period. Now, there's one more reason why you might want to change plans, but before I go into that, let me just jump in here for a minute and say that if you're finding this video helpful, please hit the like button and don't forget to subscribe because we have a lot more Simple Medicare videos coming up. Okay, the third reason you might want to switch is if your preferred doctor is moving out of your plan's network. With Medicare Advantage plans, your coverage depends on the plan's network. That means you usually have to see doctors and hospitals that are in your plan's list, your list of doctors that are covered in the network. You'll either have to pay more out of pocket if you go to a non-preferred or a non-network doctor, or in some cases, like with an HMO, you won't be covered at all. So what happens if your favorite doctor or specialist or whoever who you really trust decides to leave your plan's network? Well, you'll be stuck with a tough choice. You either need to pay more to keep seeing them or switch to another plan. And the pay more option isn't a good option. Let's say your primary care doctor is not in your plan. And you say, I'm going to go see them still and pay out of pocket. Well, guess what? They're going to order a test. Well, that doesn't work. You need someone in network to order the test. So if you have an HMO, seeing an out-of-network provider, it's just not a good idea. But the good news is you don't have to guess. You can call your doctor's office directly or work with an insurance agent who can quickly check which plans your doctor still accepts. And I will say with one caveat, be careful when you call your doctor's office. Unfortunately, we have had many situations where the doctor's office itself doesn't even know which plans exactly they accept. They may say, oh, we take XYZ insurance company. But then it turns out they take XYZ insurance company's group health plan, an individual health plan, but not that insurance company's Medicare plan. So be careful calling doctor's offices and make sure that you're really double checking and double check with an agent. And we look at the actual lists and we go on the insurance company's websites and go line by line to make sure that your doctor is in the list. But anyway, you need to make sure that you choose a plan that allows you to keep your doctor in network. Now, if your doctor is not going to be in the network of that plan anymore, you can work with an agent to find a good plan that many of your doctors and hospital specialists in your area take. And you should have other options, and hopefully there'll be plenty of options. Now, if you have a Medicare supplement plan, you don't have to worry about networks at all. As long as the doctor takes original Medicare, your supplement covers you with a few very minor exceptions. But those exceptions can be really important. There are some medical groups and some doctor's offices that are for Medicare Advantage only. If you live in an area where you want to go to a clinic that is only for seniors and only takes Medicare Advantage, your supplement might not cover you there. So sometimes you still need to do some work with a supplement to make sure that your doctor is going to be covered. So you might think, I'll switch to a Medicare supplement plan so I can keep that doctor. Well, unfortunately, going from Medicare Advantage to a Medicare supplement is not as easy as the other way around. Most of the time, if you want to switch to a Medicare supplement plan from a Medicare Advantage plan, you'll have to medically qualify for it and go through medical underwriting. And when you're going from Medicare Advantage to Medicare supplement, there aren't birthday rules either, unlike when you're switching between Medicare supplement plans. However, it's definitely not impossible to pass medical questions. A lot of people can get through no problem. If you're in good health, it's worth trying. If your favorite doctor is leaving your plan's network, maybe it's the time to go to a Medicare supplement plan instead of staying with your Medicare Advantage plan. All of these options are available to you. All of these options, PlanFit, here we work with all of them. We make every effort to be completely unbiased here at PlanFit to the degree that our agents here are not paid commissions, they are paid salaries. Those are 3 times when you should definitely switch your Medicare plan. But if you're having a hard time deciding whether it's worth it to move from a Medicare supplement plan to a Medicare Advantage plan, or even the other way around, then check out this video next, where I do a deep dive comparison of the 2 plans to find out which one is better for you.